Here's what I know. Work brings dignity. Work brings productivity and a feeling of worth. Work brings the potential of social interaction, which in turn diminishes depression and loneliness. Work brings self-esteem. Work brings pride. Work can bring money that can in turn dial down stress. When you have a chronic condition, work can also bring the inability to accommodate your disease, to have to work through your illness rather than resting or having therapy. Conventional work can bring stress and more illness. It's for all of those reasons that I'm creating a digital course and membership community called Patients Getting Paid. The course will teach you how to find patient advocacy gigs, how to find legitimate, flexible remote work, and how to start an online business, all of which can accommodate chronic conditions. The membership will provide community with others going through the training and settling into this new lifestyle with you. I hope you'll come for the course and stay for the community. Sign up today at FUMSnow.com/patients getting paid, and I'll send you an email when I launch. Welcome to the FUMS Now Podcast Show, where you'll gain information, inspiration, and motivation for living your best life with multiple sclerosis. Find us online at FUMSnow.com. I'm your host, Kathy Reagan Young. Today's guest is Mary McCarthy, the founder and chief empowerment officer of CreateRightNow.com, where she mentors people in using therapeutic journaling to heal the issues in their tissues. She herself has MS and has found that changing her diet and journaling to extract and deal with deep-seated emotional issues has made all the difference for her. She no longer takes any medication and she's doing great. She's the author of several books, one of which was just published this month, and she's got a special offer for the FUMS community on that book. Let's go meet her. Hi, Mary, and welcome to the FUMS Podcast Show.
Thanks, Kathy. Yes, I'm glad to be here.
Well, thanks so much for being here with us and sharing your story. And speaking of which, would you mind sharing your MS story? You know, like what symptoms sent you for your diagnosis and what your diagnosis was like and what treatments you've tried and how did they work? You know, just tell me everything.
Okay, well, I'll make it brief because it's been almost 30 years.
Oh, okay.
So it was 1991. And it was the springtime, and I had my yearly sinus infection and all kinds of whatever's going on in the sinuses and all that kind of stuff.
Right.
In 1991, I developed a new symptom along with that, and my balance was really off. I started having real trouble walking and banging into walls and all that type of thing. So I went through a series of visits to doctors, otolaryngologists and all that kind of things. I thought it was a middle ear thing, especially since I had a history of sinus infections. And and then it was another gift from my mother. My mother had all kinds of sinus infections too. So thanks, Mom.
Yeah, right.
So I went through all that and really, interesting tests and water in the ears and all that kind of stuff. Anyway, at that point, I was running my own management consulting business, and my clients were Fortune 1000 companies. So I was traveling everywhere, all over the world, all that type of thing. So, and I historically had problems with my lower back. Anyway, something happened. I think I had a flare-up of my lower back, and we were on with a client in El Dorado, Arkansas, and I was having trouble walking, so I went to the emergency room, and luckily the doctor that was on was an orthopedist, so he checked me out orthopedically. Yeah. And he said, "You're fine." He said, "But I recommend when you're back in Boston that you go see a neurologist. There's something going on neurologically." So I went through that, and that was a horror story trying to get a doctor. Oh yeah, in 15 months we can see you, and all that,
no.
So, but luckily I found a young doctor. He was just setting up his practice. He was a child neurologist, but certainly he was looking for patients. So,
right.
So we went got together. He suggested to go do an MRI. And came back. That was the diagnosis was MS. And but he was also very excellent, because I think being fresh out of school, he was very comprehensive, and we did the spinal tap, and he did everything just to make sure that he wasn't missing anything.
Right.
And so when it was July 19th, 1991, when he said, yep, you have to come back in, and he showed me my MRI, and the first thing I asked was, is it a terminal brain tumor? And he said, it was MS. And I said, oh, thank God, it's only MS. So that was my diagnosis. And then my second thought was, well, I guess it's time for Mary to get off the road. A year and a half before, I had achieved one of my goals, and I had purchased a beautiful house on the beach. And a year and a half later, I was diagnosed. So I thought, okay, universe, I get it. It's time for Mary to say, I've seen the 48 contiguous United States. I've done all kind of wonderful traveling. It's like, so what I'll do is I'll be at home, and I'll start a profitable internet company out of my beautiful beachfront home. How cool is that? So that's my story, and I'm sticking to it, Kathy.
Perfect. I love that story. I just had a quick question though, because that was a while ago, 30 years ago. How long did it take for you to get a diagnosis then?
I was very fortunate. It only took about 4 or 5 months.
Yeah, and that is fortunate at that time.
Yeah, I talked to the doctor. I said, because when you're showing me the MRI and explaining everything to me, I said, doctor, what did you do in the days, before MRIs and all that kind of stuff? And he literally showed me crossed fingers. He said, I just hope that I did all the tests, and you know how the medical profession is backwards. It's like they want to rule out everything as opposed
exactly.
to find out what you have. So,
right.
So that's what he said. Like he just was always aware of whatever tests were available, so he could make sure that he covered all the bases.
Got it right. Well, good. I'm glad that it didn't take too long. And I love the idea of starting an online business in your beautiful beachfront home. Good idea.
I'm a big goal person. I live by goals. I think goals are the greatest thing going.
Yeah, it's really interesting you say that, because I have noticed kind of this trend or this common thread in a lot of MSers, and that is they're very goal oriented. I think there's a type A personality trait in there that's kind of common, and that's interesting that you referenced that as well. I too am a goal oriented person, perhaps a bit too much at times, but whatever. So in her email, your publicist said that you started journaling to relieve the effects of MS, and that through journaling, you were able to ditch your prescription drugs and mitigate most of your MS symptoms. So I know everyone listening just turned up the volume and leaned in a little bit. So please tell us about that journey. How did you discover it, and how exactly did it help you with your MS?
I had an exacerbation where I lost most of the feeling and function and form and things like that on the right side of my body. And it was like I had been diagnosed about 7 or 8 years. So I was getting to the point where I was pretty much figuring out, oh, this is another little episode or whatever. When this occurred, it was more like what I hear about a stroke. I thought, I don't think this is going to come back in the typical MS 4 to 6 weeks. I think this is going to be with me for a while, and I needed a way to teach myself how to write with my left hand.
Oh, gosh.
And so it was purely physical therapy that I got into to journaling. And of course, being a high-powered businesswoman, I had to have a procedure. I couldn't just be, mamby-pamby about it. And synchronistically, a young lady introduced me to Julia Cameron's book called The Artist Way, and it's about recovering your artistry. And one of the things that she has in there is what she calls morning pages. And first thing in the morning, as close to waking up, you sit down and you write free stream of consciousness of whatever, doing it as fast as you possibly can. And I said, hey, that sounds cool. I could do that. Well, in the process, it became more than physical therapy. It was just like I started hearing rhymes. I started writing poetry. I started remembering all kinds of things. I mean, I knew I had a childhood, but as far as I remember I had some nice situations and events and all that kind of stuff. But pretty much my childhood was, to my mind, a blank.
Yeah.
But what in getting into the morning pages and the journaling, I said I found that, wow, this is getting way beyond physical therapy. We're getting into subconscious,
right? Emotional therapy,
all that sort of thing. And one of the things I remembered was that I was always left-handed, but the nuns at St. Bernard School in Pittsburgh, Pennsylvania, changed me.
Oh my gosh! And you didn't know that until you were sort of in the middle of this.
Right, yeah. Wow. As I said, it was just a fascinating experience. I thought, wow, this is a no-brainer, just sitting down, writing 3 pages every day. And like I said, it got me into understanding more of what makes me up, and the spirituality and the subconscious, just all these type things. And like I said, and what came up, and at that point, my mother was still living, and I said, "Is this what happened?" And she was able to, explain the whole story of what the nuns did. So I just said, "Oh wow, I got to keep doing this."
Yeah.
And that's how I came up with. I remembered how I always wanted to learn how to sing, because I absolutely love music, but I always wanted to learn how to sing. And that came up in the thing too, about how I was in 5th grade, I think 4th or 5th grade. I wanted to join the choral group, but the director told me that they didn't want me because I was tone deaf.
Oh, geez.
So, anyway, I mean, now you see where I get feeling the issues in our tissues. It's like, just the realization. And I've been carrying around all that kind of.
Right.
And when you suck all that in as a child, you think it's, oh, me, I'm bad. It's all that type of thing. And it was so freeing with the journaling to realize, whoa, that wasn't me. That was them. And it's like, wait, excuse me, you're supposed to be teaching me how to do things. And so as I just kept writing and journaling, and I just decided, I said, well, I said that my goal was going to be running an internet company out of my beautiful beachfront home, and this is what it's going to be. And literally, Kathy, things come up in my journal almost daily, and that's where the name of my company, Create Right Now, that just showed up one day, like journaling for the health of it.
I love that. I love that.
Okay, now
you got your direction.
Yeah, so I knew and again, going back to what we said about goals, I said, this is what I'm going to do, and it's just like, and then I just know that when I put it out there, it's the universe goes to work and does brings me opportunities or resources or whatever. So
and you were quieting yourself enough every day to allow it to surface.
Definitely, yes.
Got it. Very cool. That's really interesting. So, what treatment were you on that then you were able to ditch?
Okay, well, for about
how'd that happen?
10 or so years, I had a wonderful neurologist, and I was on Imuran, which is a pill. Mm-hmm. They historically used it for transplants, but they find it. Sometimes they find applications for other purposes. So I was on Imuran for 10 years because the ABC drugs hadn't come out yet. So, but then after about, I think, 10 or 12 years, my doctor said it starts taking on carcinogenic properties. So she took me off of that. And since I still was dealing with, this was like 1998, I was still dealing with the challenges on my right side. I needed to have a nurse come and give me the intramuscular Avonex. And of course, knowing doctors, they have to have some type of drug.
Right.
So I was on that for, I guess about a year, but every time I got it, I would get like really the flu for 1 or 2 days after and be losing 1 or 2 days a week. Well, serendipitously, synchronistically, the nurse was not able to come one Thursday night. And the next day, it's just like, oh my gosh, I feel like a human being.
Right.
Sick and in bed and all of that. And so I called up my neurologist. I said, Doctor, we've had a great, wonderful relationship. You've been fantastic, but I'm out of here. No more drugs for this kid. I said, if they find the cause and they know that that's a cure, I'm in. I said, other than that, I just don't see
I'm done.
Quality of life is tantamount for me. So it's just like, in addition to the $10,000 a year, come on.
Right.
And having to have insurance, all those types of things. So I just, and I attribute that to the fact that I had been probably 2 or 3 years into doing my journaling, my morning pages and that, and I was really recovering my power.
Yeah, you felt strong.
Absolutely. And I just saw the whole thing. You know, when I take a look at the whole scenario about, the wonderful doctor and how we were taught as children, the doctor has all the answers, or the teacher has all that type of thing. So, and again, more and more issues and just crazy thoughts and feelings, Kathy. It's like, oh my God, I've been thinking all such and such, and it's real. Anyway, I found I attribute the fact of getting off of drugs to the journaling and just really reconnecting with my true self and my soul. And it's like, wait a minute, it's my body, it's my life, and I'm paying all my money to scientists, kind of sort of think that this might kind of sort of help the information.
And meantime, you feel terrible.
Right. Yes, exactly. And so I said, as I sort of told my doctor, when they find the cause and they come up with the cure, I'm in.
Right.
Really crazy. So I just decided to say, I just wanted the quality of life, and I just knew that when you're dealing with, as you know, with a neurological situation, that's something that is not easily trackable on a blood test or an MRI or those types of things. So I knew that I was going to be pretty much on my own to have to figure out what was going on in my body and how to do it. So.
And how has how long ago was that you've been off drugs, and how has it been going?
15 years. I haven't looked back. And what I did was about 10 years ago, I completely changed my diet. I'm basically paleo, just fresh, organic foods, no processed garbage and all that type of thing. And that enabled me to get off of all over the counter stuff like Tylenol and next one, all that. And I've been off of anything over the counter for 10 years. So I've been drug free for a long, long time. And all I take today are some cannabis capsules and some fish oil. And other than that, and like I said, in the dietary change has been monumental. It's just mentally, emotionally, physically, it's just been a huge change. When now that and I've changed my whole tenor around myself, because we've been taught that our bodies, as I talked about in my first book, that our bodies are just it's letting me down, or it's breaking down. Got to take it into the shop and all that kind of stuff. But my whole thing, and again, I attribute it to the journaling and just staying in that daily process of pen to page. I attribute that to journaling to help me make those decisions. So.
Right. Well, it sounds to me, if I could synopsize this just a bit, that you found yourself, you found your strength, and you took back your control. And so you said, this is who I truly am, and I am a strong woman, and I have the ability to do this on my own. I don't need those drugs that make me feel worse, and I'm going to change my diet, and that's helping. And, so look at what I've done so far. So I'm strong enough to do this myself. And I think another thread that I've noticed in folks is those who feel strong and feel some semblance of control, whatever that is, do better. And those who feel that everything is being done to them, and I don't just mean in MS, I mean across the board,
yes,
do much worse. So find your power, find your strength, right? And you suggest doing that through journaling. That's so cool. So you found that journaling was really kind of the base point from which all of this grew. So I imagine at some point you said, I need to share this with the world. There's others who can benefit from this, right? So what was your first foray into sharing this with others?
It was setting up createrightnow.com.
Gotcha.
My business. So it just grew from there. And what I've now done is design probably about 20 some different workbooks on different challenges that we face in life. Like one that my latest one is Empower Yourself. Another one is Heal Your Life. Another one is for caregivers, so that to show people the practicality of that you have this free self-care, self-therapeutic tool that can help you deal with all the slings and arrows, or shall we say,
right,
of life. But more importantly, it'll help you clear out the issues in your tissues. It'll help you process the past and put the past where it belongs, in the past, rather than continuing to carry it around with you. So it's just, and I guess the focus has always been as it's Create Right Now is focusing on the process, not on the mechanics of, what are the procedures? How do I do it? That type of situation.
Right. So I think you've already answered this question, but I'm just gonna ask it for clarification anyway. First of all, let me say that I love that quote where you say you're you mentor health conscious people in using therapeutic journaling to heal the issues in your tissues. I heard you just say that again, and I saw it on your site. I love that. But what is therapeutic journaling? And how is it different from writing in my diary? Is it just more directed, or what's the difference? Writing in
a journal or journaling is thinking with your heart, not thinking with your head. And that's something very different, tying into our and reconnecting with our feelings and emotions, that it's really okay, because being emotional and having feelings is part of who we are. So it takes it's a behavior change, Kathy. It takes us being honest with, what am I really feeling, or where is this coming from, as opposed to continually living in our head and discounting, oh no, I can't do this, I should be doing that, or allowing our inner critics, in my case, to overwhelm us and continue, and fear and all these crazy things that are driving us crazy. So it's the therapeutic journaling is really getting past the fear, facing the fears that your mind has been spewing all these years, and doing your own self-therapy and really understanding who lives in your body.
Yeah.
And really see that you have power, talents, all these things that are sitting there, hidden, because we've been so externally motivated, and we've been living our lives out there as opposed to from the inside out.
Right. So that helps to take back the power. So you are the founder and chief empowerment officer. I love that, at createrightnow.com. And I just want to Tell everyone that is CreateWrite, WRITE now.com. By the way, as I say on most of these episodes, don't worry about writing this stuff down. I take all the notes for you. All of this will be in the show notes. But so you're the Chief Empowerment Officer at CreateWriteNow.com. And I was looking at it. So you offer writing prompts and mentoring and a lot more, right? So I know we referenced books, and we'll get back to that. But what exactly do you offer at Create Right Now?
One is a comprehensive introduction to therapeutic journaling. You'll see on the homepage that we have all types of information, free ebooks to download, like how to use journaling to handle the stress and strains of life, how to use journaling to improve your self-esteem. So we have all kinds of complimentary ebooks. Then we also have a blog that carries journaling journeys of journalers. Like journalers will write a blog article about their experiences in dealing with journaling and why they're stuck to the page and things like that. Mm-hmm. And that's interesting because that's probably the highest thing that's clicked on my my website or the stores of other people. And it's truly eye-opening to people. It's like, oh my goodness, I can deal with my health issues. I can deal with my crabby next door neighbor. I can do right. That people, and that's what's formed the basis of my book I just wrote, Heal Yourself with Journaling Power. There are 10 stories of journalers that have dealt with things like alcoholism, anxiety, cancer, change of life, whom I want to grow up. So that's one of the very, as I said, popular parts of my website. Each month I post what I call unique soul-searching journaling prompt, and we're now up to 375.
Oh my gosh!
So people go, oh, I don't know what to write about.
Yeah, there you go.
You have 375 journaling prompts to choose from.
No reason not to write.
And then I have a store, and I have what I call self-paced journaling courses. They're PDF workbooks. And as I said earlier, I think I'm up to about 22 that cover everything from build a lasting journaling practice in 14 days to empower yourself, to love your body, to reset and recharge your life. Those are some of the titles. So I would think that someone that wants to, as I say, wants to discover who truly lives in their body and what's it all about, Alfie. Anything I can possibly think of for people that no matter where they are and what floats their boats. And that's what's exciting about journaling. There are only two guidelines for journaling for the health of it. One, it's pen to page only, and it is daily. Other than that, you're on your own as far as whether you want to use crayons, you want to use a unlined notebook, you want to do it in the morning, you want to do it in the evening, you want to do it out at the local park. It's all up to you. That's what's the beauty of journaling. There, like I said, there's two guidelines, but other than that, what you want to do, how you want to do it is up to you.
So you do not advocate for typing it on your computer?
Oh, if you're interested in stress reduction or unloading some, whatever thoughts or feelings, that's fine. But if you're really, if your intent, your goal is to understand who you are and why you're here and your purpose, and really dig deep and dig through all the things and face the fears, deal with the issues in your tissues, and reconnect with your soul.
Yeah.
And that's what pen to page journaling is all about.
Awesome. One thing you mentioned I saw on your site too was becoming your own healthcare advocate. What did you mean by that?
I mean that we have to own our body. We have to own our whole being and get to know our body and take it from there, as opposed to, we're so much into a reactionary, we got a headache, we got to get a Tylenol, or this pain has been going on, we got to run to the doctor. And that's, again, another thing that journaling has helped me with, is to settle myself down and say, what's going on here? What's happening? And that's, again, where journaling helps, because I journal all the time with the pains, because it may be, the final result may be a physical pain, but there's, again, we get back to the issues in our tissues. Yeah. There's something way going on beyond that. And I think that's also a reason why I'm able to not have to take the drugs and things like that, because
you're addressing it probably at the cellular level, because you're getting rid of all the nonsense, right? And you're making yourself stronger.
True, and realizing that all these quote unquote drugs or painkillers or whatever, they're only dealing with symptoms, and as we're saying, there's so many deep-rooted things going on that we just need to keep digging and digging and digging, and it's like, oh my goodness, or just like I said, just to find out,
what's in there.
You're right, and just having the discussion with my shoulders, like, what is going on, where's it coming from, and being able to tap into your childhood or situation or whatever. Mm-hmm. Oh, that's where this is coming. And it's really understanding that our body is talking to us and will tell us what it needs. And we just, when you talk about becoming our own primary care provider, that's where I feel I am. And that's where I got to after I got off of the drugs. It's just like, wait a minute, this is my life. This is my body. Let's figure out, what's going on. And then you do the research and things like that. So it's really a complete behavior change, a mental change. It's like Bruce Lipton, who's the neurobiologist, says, we've just been so programmed, and it's unbelievable how many things we're carrying in our heads, thoughts, feelings, craziness that have not been processed. And that contributes greatly to becoming ill. And I think that's why, to me, it was so, in going through the journaling and digging deeper and all that, of course, having a health challenge called MS, meaning myself, and having it be a neurologic situation where your internal communication is, you're fighting yourself and all that type of thing. And I said, well, that's me for sure. It's just like, oh my God. And that's why I'm really, that was my concern. It was when I first was diagnosed, was that, about something being, I hope my life is not over. And it's like when MS is like, oh my gosh, it's a neurologic thing. That means no surgery. And so I just, from day one, I was just always into what's this all about. But like I said, so I think that we, again, I guess what we talked about earlier about reclaiming ourselves, our true self and empowerment, and just really saying, oh, wait a minute, and this is crazy with me running to a shoulder specialist and or whatever the scenario was, or having to follow the protocol of whatever doctor you go to see. I'm out. And now what's interesting and exciting in the world that we live in, there are more and more medical doctors that have had the experience of something, what's going on in my body, and really realize how left-brained it is, and how it's all about, the organs, the things that we can hold on to or whatever. Right. I mean, there's so much going on way below
the surface. Yeah.
And so, but they've been experienced, they're now out and doing their own thing and really talking about getting people to be their own primary care provider.
Yeah, I love that.
And really take charge of their life and just say, no, that doesn't make sense to be doing such and such. And really, but at the same time, also helping us through the journaling helps us get clear on, okay, so I need to go see the doctor. What's my agenda? What's my outcome? I'm really thinking more as a business interaction. And it's like, is this the partner that I feel is going to help me and my body? And that's a very huge change.
Yeah, definitely. Paradigm shift in the way you look at things. You've inspired me now. You referenced shoulder a couple of times, and I have to tell you, I am dealing with a frozen shoulder right now, which is one of the most painful things I've ever dealt with in my life. And I've tried just about everything, but I'm going to write to it today. And I'm going to tell it to stop hurting. And I'm just going to give my mind a little time to think through this and see if something doesn't come up and if I can't come at it from that direction, because I do feel like I've tried everything.
Would be to treat it as you would a young child, and talk about how she or he is feeling, and get into the feelings around that. Because I hear you with the frozen shoulder. I had the frozen shoulder. It is by far the worst thing, even past broken bones and all that. I've just never experienced it.
It's horribly painful, no question.
So, and I think just to have the conversation and this with our body, because no one ever asks. We're just you're pain, you did that all. So it's a totally different thing. It's like, what? You're asking for my input. You're asking me how I feel.
Yeah. My shoulder's going to say, I hurt like hell right now. But it's a good place to start. I appreciate that. I've been inspired. This, Mary, has been such an illuminating conversation. I thank you so much for sharing your MS journey and what you found to be so helpful. And I'm sure people would like to get your books and your workbooks and learn more about you. So if you would please tell us where they can find you.
I'm at Create Right Now, and the right is WRITE now.com. And you'll find everything about me and my resources and everything about journaling for the health of it and how you can heal and issues.
They can purchase your books right there?
Yes, in my store, both, and they can get autographed copies.
Oh, excellent. And I believe you mentioned to me earlier that you had some sort of special that you were going to offer the FUMS listeners.
Right. If they go into my store and buy whatever, and they're checking out, if they enter FUMS, that will give them $10 off their purchase.
Oh, excellent. Well, thank you for that gift. Appreciate it. So thanks again for being here. Really appreciate it. One more thing. Here in the FUMS Nation, we talk to this stupid disease as it deserves, and we tell it FUMS every day. If you would please, Mary, raise your middle finger and salute to MS and say it with me on 3. Are you ready?
I'm ready.
1, 2, 3.
FUMS.
Perfect. Thanks so much, Mary. Appreciate it.
Oh, thank you, Kathy.
Thanks, everybody. I really appreciate you listening to the FUMS Podcast Show. Be sure to subscribe to it so you won't miss an episode. You can do that right on the website at FUMSnow.com. While you're there, sign up for the free email list so you'll be among the first to know of any new findings in MS research, new therapies and products, as well as any blog posts and podcast episodes I release. Want to chat with others in the FUMS community? Join us on Facebook at FUMS Now. Thanks again, and don't forget to talk to the stupid disease as it deserves. Tell it FUMS every day.